In this third and final section of the iGel O2 Airway in-service program, we'll talk about management and maintenance of the airway, some airway decision making, and we'll look at the quality improvement process that we use. First, occasionally when we insert the iGel, we might meet slight resistance when the airway is partially inserted. This will happen as it rides along the posterior and anterior fascial pillars. Generally, a small amount of pressure will help the airway work by those pillars. Again, proper lubrication of the airway helps considerably. If there is some resistance encountered, lifting the back of the chin or rotating the airway side left and right should clear it and allow it to advance. We'll see that in this movie.
Let's look at some iGel insertions in real patients. Note the sniffing the morning air position and the gentle press down on the chin. See how there is no need for fingers to be inserted in the mouth. There is never a need to apply excessive force or to repeatedly push down on the device once definitive resistance has. Let's look at some iGel insertions in real patients.
We'll talk about
Note the sniffing the morning air position and the gentle press down on the chin. See how there is no need for fingers to be inserted in the mouth.
Cardiac arrest.
There is never a need to apply excessive force or to repeatedly push down on the device once definitive resistance has. Let's look at some iGel insertions in real patients. Note the sniffing the morning air position and the gentle press down on the chin. See how there is no need for fingers to be inserted in the mouth.
The BLS airway probably still preferred.
There is never a need to apply excessive force or to repeatedly push down on the device once definitive resistance has. Let's look at some iGel insertions in real patients. Note the sniffing the morning air position and the gentle press down on the chin.
Should be able to pick through.
See how there is no need for fingers to be inserted in the mouth.
And decide what's best for the patient.
There is never a need to apply excessive force or to repeatedly push down on the device once definitive resistance has. Let's look at some iGel insertions in real patients.
Quality improvement process.
Note the sniffing the morning air position and the gentle press down on the chin.
Been rolled out in the state of Michigan.
See how there is no need for fingers to be inserted in the mouth.
By our professional standards review organization.
There is never a need to apply excessive force or to repeatedly push down on the device once definitive resistance has. Let's look at some iGel insertions in real patients. Note the sniffing the morning air position and the gentle press down on the chin.
Again, the size
See
of the
how
airway,
there is no need for fingers to be inserted in the mouth.
How many attempts were made?
There is never a need to apply excessive force or to repeatedly push down on the device once definitive resistance has. Let's look at some iGel insertions in real patients. Note the sniffing the morning air position and the gentle press down on the chin. See how there is no need for fingers to be inserted in the mouth.
What method you use for securing the airway?
There is never a need to apply excessive force or to repeatedly push down on the device once definitive resistance has. Let's look at some iGel insertions in real patients.
These will be looked at every chart.
Note the sniffing the morning air position and the gentle press down on the chin. See how there is no need for fingers to be inserted in the mouth.
Provided rapidly insertable supraglottic
There is never a need to apply excessive force or to repeatedly push down on the device once definitive resistance has. Let's look at some iGel insertions in real patients. Note the sniffing the morning air position and the gentle press down on the chin. See how there is no need for fingers to be inserted in the mouth.
EMS Clinical Coordinator.
There is never a need to apply